Hello, good afternoon. My name is Dr. Trudy Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to our weekend open clinic with Dr. Trudy Ufondu. And today it's a very, very important day in the group because we're going to look at things that every singular woman out there should be conversant with. So we're going to look at the color of your period, your monthly period. And we're going to try and look at the connections between the color of your monthly period, between the consistency, between a couple of things that happen when you bleed. And we are going to tie it to your ability to become a mother. Very important topic. So the color of your period in regards to your fertility, in regards to your general health, in regards to a couple of gynecological problems. And I'm going to use my very good friend, the female reproductive system, to illustrate. So I'm going to give one a few minutes so you can settle in. Remember, this channel is open to everybody, especially women who want to start their family. For you to know about the female reproductive system, you need to have the adequate knowledge. So the essence of this clinic is to teach you everything you need to know about the female reproductive system so you can equip yourself with the right knowledge. When you equip yourself with the right knowledge, you can practice better. When you practice better, the possibility you're going to get good outcome is very high. So once you join and you're able to hear me clearly, just indicate, give me a wave, indicate you can see me clearly, indicate you can hear me clearly. Then once I have an appreciable good number, I'm going to start. When I'm done with my presentation, you can ask me all your questions. So we're going to look at various colors of your monthly bleeding and the interpretation regarding your fertility, regarding your ability to start your family. Okay? So how can the color affect your ability to become pregnant? Do you need to worry when your period is showing black, when your period is brown, when your period is bright red, when your period is pink? That's what we're going to look at. And I want you to just give me a few minutes so we can allow other people to join. So if you know any of your friends who indicated interest in this clinic today, but you can't see them in this clinic, please tell them we're about starting. Once I have an indication from my admin, I'm going to start. So admin, once you come in and you give me a go, I'm going to start. I can see Onyx Christie. Thank you for coming. We are going to take time to understand the implications of the color of your monthly bleeding, your fertility, and your ability to start your family. Okay? Now, without wasting much time, let's start because we have a lot to talk about. Okay. Now, first of all, the blood you see during your bleeding, during your period, it's actually similar to the exact blood you will see when you cut yourself. So if you pay attention, when you cut your finger, you will see bright red blood. That's the expected blood. It's about the same blood when you are bleeding, but not exactly the same. When you see blood on your pad or tampon or in the toilet, it's actually a mixture of the blood and some tissues from the womb. The lining of the womb is called the endometrium. So the difference between your normal bleeding when you cut your finger and the bleeding that comes from the vagina during your monthly bleeding is because the bleeding that comes from the vagina is not just pure blood, it's a mixture of the cells, of the tissues that cover your womb. That's the endometrium. Now, how much of each, along with other factors, will be influenced by your period? Your period normally should indicate how healthy you are, especially the appearance. Now, the appearance of your period can fluctuate. It can vary from day to day during your period. It can also vary from cycle to cycle across different women. So your period in January might not be the same with February. It might be different in March. It might be different in October. It might be different in consistency. It might be different in the color. It might be different in the flow, in the number of days. Now, remember the normal. A woman within her reproductive phase of life is supposed to bleed at least 2 days for maximum of 7 days. So 2 to 7 days is the expected duration of your bleed. If you bleed more than 7 days, then there's a problem. If you bleed for just 1 day, there's a problem. Now let's start with what actually leads to menstrual bleeding. This is where you need to be conversant with the female reproductive system. The female reproductive system, which generally portrays the female body in a place we call the cycle, the menstrual cycle, it's controlled by reproductive hormones. And I'm going to mention the important ones. Number one, estrogen. Very important hormone, which actually defines women's role as mothers. Number two, your progesterone. Number three, your FSH, follicular stimulating hormone. Then number four, your LH. So I'm going to stop at these four major reproductive system hormones. Now, these hormones will regulate when and if your ovaries will produce egg. So what will lead to production of eggs is actually the function of the hormones. There is a key hormone that goes to the ovary every singular month. It's called the FSH, follicular stimulating hormone. This hormone is produced in a higher center in the brain. It will go to the ovaries and it will start preparing one egg inside a vehicle we call the follicle. So by the time that egg is developing inside that follicle will become dominant follicle. Now, at the middle of your cycle, which is supposed to be your ovulation, another important hormone, which is the LH hormone, luteinizing hormone, we go up. It's called LH surge. Once LH surge goes up within 24 hours, if every other thing is constant in your body, you release the egg. The process of releasing that egg is ovulation. Now, by the time the egg is getting ready, the cover of your womb, which is the endometrium, is also thickening under the control of estrogen and progesterone. So every woman is structured in such a way that every month, every cycle, you are supposed to be pregnant. Now, if pregnancy happens, you're not going to bleed. But if there is failure of pregnancy to happen, that thickened endometrium, that thickened cover of your womb will break down. When it breaks down, the excess blood, the blood vessel that will be busted when it breaks down is what will pass out as your menses. So when you are bleeding, it's an indication that pregnancy did not happen. If pregnancy happened, you are not supposed to bleed. Every bleeding in pregnancy is considered abnormal. So the reason why you bleed every month for women that still have reproductive ability is because of failure of the released egg to be fertilized. Once the released egg is fertilized, then pregnancy will start. Development of embryo, they will come back to implant in the womb. But if there is failure of pregnancy, it will break down. So the component of your menses is blood and tissues from the endometrium, which is the cover of your womb. So the mixture of this blood will be what will make up your flow. Now, if you pay attention, there are some women, when you bleed in clots. Now, the fact that the menstrual bleeding blood contains cells and fluid is actually what makes the flow from your vagina thick. But there are a couple of other things. So if you notice, the bleeding you will experience when you cut your finger and the bleeding you will experience when you look at your tampon or your pad, they are not the same. Why? Because the bleeding from your womb contains cells. There are a couple of other important things that happen in the body when you cut yourself. So if you notice, when you cut your finger, it will bleed for just a few seconds. Then you will form clot. That forming of clot is under the influence of what we call clotting factors. So the blood will be thick, solid. The reason is because if it doesn't happen, you're going to bleed out and you're going to die. So if you are healthy, when you cut your fingers, you will notice that it will just bleed for just a little moment. Then the clotting factors will set in and bleeding will stop. The same thing is applicable to your period. When blood is flowing out based on the disintegration of the cover of the womb, you will notice that sometimes it will come with just tiny clots. But the bleeding from your vagina is not supposed to be thick regarding clotting. It's just minimal. However, if you notice that you have excessive clotting, during your period, which can happen. If you have visible clotting, excessive beyond what we expect, then it's possible you might be having problems in your system. We need to investigate. Now, when you are bleeding excessively, when you bleed beyond what we expect in regards to clot, that particular process is termed menorrhagia. That means heavy bleeding. Now, let's talk about the consistency of your bleeding. Normally, there are two types of bleeding you can have. You can have thin, watery bleeding or thick and sticky bleeding. If you pay attention to your body, you will notice the difference. Most times, thin, watery discharge is usually pink, whereas thick, sticky discharge is normally brown. Now, the changes in your cycle can be different. The consistency, that means, is it fluidy? Is it sticky? Is it thick? Is dependent on the time you are bleeding. If you pay attention to your body, it's not how you started bleeding that it will be towards the ending. Some women will start bleeding heavy. Some women, it will start with thick, sticky discharge. Then over time, it will be watery and thin. If you pay attention, when it's thin and watery, it's namely pinkish. When it's a little bit thicker, it's mainly brown. So these changes can suggest if there is a decrease in the lining of your womb, if there is a problem, if a woman is going through menopause, or if a woman is just starting her period, it's expected that when you're going through menopause, the quantity and the frequency of your bleeding will be lighter. Why? Because the cover of your womb, which is the endometrium, it's now thinning down. Remember that the cover of your womb is controlled by estrogen. As a woman is getting older, her estrogen will be dropping. Then you begin to feel dryness. Then you begin to feel hot flushes. You begin to feel low libido. This is in preparation of menopause. So when you are getting ready to enter menopause, most of your bleeding will be lighter. Now let's go to the appearance of the blood. This is actually the major focus of today's clinic. So what your period looks like vary from cycle to cycle. What your period looked like in January might not be what it looked like in March. It might not be look like what we have in October. It can vary from day to day. So how you bleed in the morning might not be how it will appear in the evening. It can also vary within cycle. The variation can just give us a sign that something might be going on. But your menstrual blood can also be described just by the color. And I'm going to talk about the different colors. Number one color, bright red. Bright red color is an indication that you just started bleeding. So if you pay attention to your body, the first day you bleed, you will notice is what? Bright red. So bright red blood is a recent, quicker blood that will quickly go out of your cervix into your vagina and you will pass it out. So bright red blood, it's a recent bleeding that starts your period. You will also notice that when you are having so much cramp, when you are bleeding, you notice that the blood will also be bright red. Why is it bright red when you're cramping? Because when you are cramping, your womb is contracting. And when your womb is contracting, couple of all those cover of your womb will be breaking down. So when you have excessive cramping in pregnancy, or anywhere, if you are bleeding, if you pay attention to that particular bleeding, it's mainly bright red. Now, let's go a little bit deep further. What about if your bleeding is dark red? Some women will even describe their bleeding as black. It's dark red, brownish black, suggestive of major problems. Not all the times. So a darker flow ranging from dark red, brown, or black will suggest older blood. Older blood. So you will notice this when you are about to end your bleeding. So darker red, brown, black blood will suggest older blood, which will flow slowly. For most women, their period begins to get darker over the course of a day. So if you bleed for 5 days, you will notice that it becomes darker on the 5th day or on the 4th day compared to the first day. This is because older blood will get released as deeper parts of your womb will be shedding and be releasing blood. Now, another thing you need to notice is this. When your blood is exposed to oxygen, it begins to go through what we call oxidation. So the color can change. So if you notice your bleeding is brown, black, and you begin to freak out, you don't necessarily need to worry about that. It's a transitional thing. So typically, the color of your bleeding normally is a shade of two darker, red, pink, brown, black. Depending on the period you have in your cycle, they are completely okay. But if you notice a consistent dark, brownish, black blood throughout your period, then there's a problem. We need to go and investigate and figure out what's going on. You may have noticed that if you ever had your bleeding and it's clotting, most times when it's clotting, it's also black or brown. So pay attention to this. Now, some women will notice that their bleeding is pink, and you begin to worry, you begin to freak out. Some women will actually notice that in their period is pink during some point in their cycle. You don't need to worry about this. It's usually the most common color of your bleeding at the beginning or towards the end of your bleeding. Completely okay. Nothing to worry about. It's completely okay. Now, some women will notice extra thickness in their bleeding. The consistency means, is it like water? Is it like pap? The consistency of your flow is part indication of how many of the cells that cover your womb was mixed with the blood. So some women will notice increase in the consistency, in the thickness of their normal bleeding. When you see this, when you're bleeding in lumps, when you're bleeding in crumbs, in your bleeding, it might be an indication that you have fibroid. The commonest thing that will lead to thick bleeding, that will lead to more painful bleeding, that will lead to extended bleeding. So suddenly you're bleeding more than 1 week. Suddenly it's coming out in clots. Suddenly you feel like you're fainting. The most important cause of bleeding in clumps or bleeding thick is what? Fibroids. Especially if those fibroids are located inside the womb. Remember, there are principally 3 types of fibroids. Intramural fibroid, inside. Submucosal fibroid, inside. Subserosal fibroid, outside. So of the 3, if you have intra, means inside, or submucosal, the possibility you're going to bleed heavy is there. The possibility is going to extend beyond 5 days is there. The possibility is going to be painful is there. So once you know you're normal, once you know the amount of bleeding you are having, you can begin to seek help early. So different women will have different amounts of blood and different period based on their cycle. It's normal for some women to bleed very light throughout their period. It's also normal for some women to bleed extremely heavy blood, and it might be their normal. But the question is, if you previously used to bleed light and suddenly it's very heavy, it's very painful, it's going beyond 7 days, then there's a problem. Now, if you recently noticed that previously you used to bleed heavy and you are no longer bleeding at all, then we have a problem. So depending on your normal, we can begin to plot the abnormal. If you are bleeding so much, I want you to listen to me carefully. If you are bleeding more than you are replacing, you might actually have a problem. We need to take you to the hospital immediately. Because when a woman is bleeding excessively, she's losing a lot of hemoglobin. Hemoglobin is an important oxygen carrying capacity in your blood. When you don't have enough hemoglobin, what will happen? You become anemic. When you become anemic, what will happen? You can have a lot of damages in your body. Some women will collapse. Some women will have a couple of complications. Some women will actually need blood transfusion. So if you notice you are a heavy bleeder, it's important you talk to your provider so we can know what's going on. Extremely heavy, fast bleeding might be a sign of severe bleeding disorder or gynecological problems. So the key word is to do what? To know when to transition and seek help. Once you know you're normal, you can begin to plot the abnormal. So just to summarize, bright red color of your bleeding is an indication that you just started bleeding. Brown, brownish, dark blood is an indication that you're about ending, or you're bleeding from the inside, or it contains more tissues. Pink, completely okay. If it's bleeding thick, if it's coming out more in clots, likelihood you might have fibroid. But overall, If a woman has a regular bleeding, if a woman has a predictive bleeding, if you know that every 14 days you will bleed, if you know that every 12 days you bleed, if you know that your cycle is 28 days and you bleed for 5 days and you bleed for 2 days, that's your constant. If you can use that to pinpoint your fertility window, if you can use that to pinpoint if you're ovulating, you are gonna increase your chance of becoming pregnant. Now, if you notice some abnormality, you can also use it to report to your doctor early. So the color of your bleeding can indicate how soon, how later, if you're going into menopause, if you're in your menarche, if you still have a chance. Some women will suddenly stop bleeding completely. If suddenly you haven't bled for 3 months, it's called amenorrhea. It might be an indication of a couple of things we need to look at. If you haven't bled for 12 consecutive months and you notice you're having dry vagina, and you notice you're having low libido, and you notice you're having hot flushes, we need to check you and rule out possibility of menopause. If you have gone into menopause before 40 years, it's called premature menopause or primary ovarian failure. And we need to figure things out because when you go into menopause, you no longer have X. When you don't have X, you will not have ability to become pregnant by yourself. Okay? So the clinic is now open. I want you to start asking your questions in the next 10 minutes. I'm going to sit back and I'll provide you feedbacks. Remember, today we are looking at the color of your bleeding and the likely implications regarding your fertility. So please go ahead and start asking your questions. I'm ready to take care of your questions. So please feel free to ask your questions. Okay? The clinic is open. Go ahead and ask your questions. Make sure you're conversant with the female reproductive system. Make sure you know the various parts. So this is the vagina. Beyond the vagina, you have the cervix. Beyond the cervix, you have the womb. Beyond the womb, you have the tubes. Beyond the tubes, you have the ovaries. So from the vagina to the cervix to the womb is also called the uterus. To the tubes, women have 2 tubes and they also have 2 ovaries. Very important aspect that every singular woman should have. Now, the commoner cycle in a woman is 28 days, but not all women will have 28 days. If your cycle is between 21 to 35 days, it's normal. It begins to become abnormal if it's beyond 21 days or more than 35 days. So if you bleed every 45 days, there's a problem. If you bleed every 19 days, there's a problem. And when you have a problem, where do you go to? A gynecologist. If you want to become pregnant, you go to a fertility specialist. So please, I'm waiting for your questions to come in, so I will provide you feedbacks. What color of menstruation can affect fertility? So like I mentioned, if you noticed that previously you used to have pink or bright red color of bleeding, and suddenly it's changing to thick brownish black bleeding throughout your menstrual bleeding, then it's an indication you might likely have fibroid. It's an indication you might likely have bleeding disorder. It's an indication you might even have a couple of other gynecological problems like endometriosis and all those OCs out there. So once you know you're normal, if you used to have bright red bleeding and it's coming out without pain, and suddenly you begin to experience excruciating pain, dark, even dark red, dark brown, dark, completely dark, then there's a problem. So once you have a deviation from the expected color, which is bright red when you recently started bleeding, or a little bit dark red when you're just about ending, or pink, if you notice that throughout your bleeding it was black, it was coming out in clots, or you've been bleeding excessively, then you need to go to the doctor immediately. The earlier you go to the doctor, the better we can figure out how to help you. Okay? All right. Should a woman be worried if her period goes abruptly from 5 days of bleeding to 2 days? Completely okay. You don't have to worry. So long as you're bleeding at least 2 days. So 2 days is the lower limit of normal in your bleeding duration. The upper limit of normal is 7 days. So if a woman suddenly graduated from 5 days to 2 days, it's actually a good thing because the lesser you bleed, the better for you. In some clients, if some women are really having very bad bleeding. There are some women that when they are bleeding, they don't have any life. It affects every singular thing about them. They won't go to work. They won't eat. Their days are completely messed up. So if you notice that you used to bleed for 5 days and it reduced to 2 days, it's actually a blessing in disguise because 2 days is still normal. But if you notice that you used to bleed for 5 days and suddenly you just bled for 1 day, or you're bleeding for more than 7 days, then there's a problem. So the normal range is 2 to 5 days. Once it's within 2 to 5 days and you're bleeding, there is a difference between bleeding and spotting. You have to bleed. You have to have a normal bleeding. This is where you need to be careful. Some women will have spotting during pregnancy and they will go about and say, oh, doc, I'm bleeding in my pregnancy. Is it okay? There is nothing like menses in pregnancy. Once you are confirmed pregnant, all forms of bleeding must be completed, must be reported to your provider because it's a danger sign. Some of them we might not worry about. It might be implantation bleeding. But once you have frank bleeding in pregnancy, is a danger sign because ordinarily the body of a woman is structured in such a way that if pregnancy happens, your estrogen and your progesterone will keep on maintaining the embryo until the placenta will start producing hormones to support that pregnancy. But if pregnancy doesn't happen, the level of progesterone and estrogen will go down. So what normally leads to your bleeding is low level of estrogen and progesterone. Once you have that, you start bleeding. So 2 days, okay. 3 days, okay. 4 days, okay. 5 days, okay. 6 days, 7 days, okay. 8 days, we worried. 9 days, 10 days, we begin to seek help. Okay? All right. Is it possible for ovulation day to vary, say 21st day, when in the average is 28? Now, the variation in your ovulation can happen if your cycle is moving. Okay, now what I want you to focus on is the range. So if you have a 21, 22, 23 cycle, it's still normal because you can find the average of 21, 22, 23. You will still have it in that range. If you find a variation of 28, 29, 35, it's still within the normal range. So it's varying on the same direction. But if you notice your 21 days and suddenly it's 35 days, you can see the gap. We begin to investigate. So what you need to know is to find the average. So if you have a regular 28-day cycle, standard 14-day is your ovulation. If you have a regular 30-day cycle, standard 16-day is your ovulation. Remember that the first day of your cycle is the first day of normal bleeding. Some women will notice that before they start bleeding, they will spot. Spotting is not counted as part of your bleeding. So pay attention to me. If you spot for 2 days and you bled for 4 days, your total bleeding days is not 6 days, it's 4 days. If you started bleeding and you bled completely for 4 days, then you spotted for the last 2 days, your complete bleeding days is not 6 days, it's 4 days. So we count the normal bleeding. So this is why you need to know the difference between bleeding and spotting. So once you're within the normal range, no worry about it. Okay? All right. How does implantation bleeding look like? Very light, transparent, about 24 hours bleeding. So implantation bleeding is not like your normal bleeding, which will come out with very heavy, very thick. It's normally light. It will normally last for about 24 hours. Once it goes beyond that particular time frame, then we begin to worry. Okay? So implantation bleeding is just simply what happens in some women if the embryo is implanted in the womb. So remember, the egg and the sperm will meet in the ampulla, a special place in the tube. Once fertilization has occurred, they will produce an embryo. Once embryo is produced, it will come back to implant. So in some women, during this implantation process, they can bleed. It's called implantation bleeding, okay? It's supposed to last for just about 24 hours. So that's the difference. Okay, are there any side effects of using painkillers during menstrual cycle? Correct. There are some painkillers we need to be careful with when we are prescribing to women. So there are some women we will not like to give painkillers we call NSAIDs, non-steroidal anti-inflammatory drugs. There are some women we might need to just give paracetamol. There are some women we might need to give ibuprofen. So depending on your own individual factor, there are some we will not tell you to use. There are some anti-pain medication that can help you to reduce the pain and also reduce the extent of bleeding, the number of days you're bleeding. So be mindful. Some women might not react well with NSAIDs, and some women will react well with NSAIDs. So the decision of the type of painkiller you will use will be dependent on your body, will be dependent on if you want to become pregnant, will be dependent on a couple of problems you have in your body. Okay? All right. Okay. If a woman has always had a very long cycle of about 60 days, is that an indication she is subfertile? Correct. Once your cycle has exceeded 35 days, so in this situation is 60 days, so it's a completely irregular cycle. Once your cycle is not within 21 to 35 days, it's irregular. So irregular means it's all over the place. So we can't even pinpoint if you're ovulating. We can't pinpoint what's going on in your body. Some women have this. If you are bleeding every 60 days, it's completely abnormal. If you are bleeding every 45 days, it's completely abnormal. If you're bleeding every 10 days, that's a problem. So 60 days is a long period. It's an extended cycle. 10 days is a short cycle. We want it to be within 21 to 35 days. So yes, Kenneth, if you are bleeding for 60 days, that's an indication for subfertility. So subfertility means reduced fertility. You need to be careful because in this lady, the first thing we have to look out for is her age. So if a woman that is 48 is now bleeding every 60 days, previously, when she was 45, she was bleeding every 35 days. And suddenly, she's now bleeding every 60 days and she's 48. What will be the first thing that will come to our mind? It's possible she's getting ready to go into menopause. So we need to investigate. What do we do to rule out if she's gone into menopause? We are going to look at some hormones. Two important hormones, your anti-Mullerian hormone and your FSH, follicular stimulating hormone. If your AMH, which is an indication of the quality and the quantity of your eggs, if your AMH is reduced and your FSH is high, and you haven't had your bleeding for 12 consecutive months, until proven otherwise, you've gone into menopause. Every woman is going to go into menopause. Some women will go into menopause in 40, some women will go into menopause in 50, some women will go into menopause in early 60. It depends on your own individual constitutional factor. So 60 days, see a gynecologist. If you want to become a mother, see a fertility specialist. The earlier you do this, the better. If a woman with heavy flow, with clots, notices that after childbirth, the heavy flow has reduced with no clots, does it mean she has had fibroid which shrunk after birth? The only way for us to confirm if you have fibroid is to go for the evidence. So how do we rule it out? We go to your womb, we run an ultrasound. If you don't have any fibroid, then it's changing. There are some women that will be having very heavy bleeding before pregnancy. Then after pregnancy, normal, no painful bleeding. So women are wired differently. Then there are some women that will have normal bleeding, no pain. Then after childbirth, they begin to have heavy bleeding. Here's the bottom line. Once you notice any deviation from your normal, so if all your life, anytime you're bleeding, it's heavy, you're worried, you don't go to work, you don't go to school, then suddenly nothing is happening, you need to go for check. But most women will notice a difference in their cycle after delivery. Some women will notice some gynecological problems that will be better. Some women that have endometriosis, PCOS will notice is regularizing. And some women will notice new symptoms. So the key word is to know your normal. But this is the bottom line. Pregnancy will change everything about you, including your cycle. You will not be the same woman in your reproductive system. Sometimes it will change for better. Sometimes it will change for the south. But the most important thing is to know your regular. I love that question. The only way for us to confirm you have fibroid is to go for diagnosis. So we need to go into your womb. We need to classify that fibroid. Is it intramural? Is it submucosal? Is it subserosal? We need to know where that fibroid is located. The three important types of fibroid is subserosal fibroid, outside the womb, intramural, and submucosal fibroid. Intramural and submucosal fibroid are located on the inside of your womb. Okay? But generally, if you have fibroid, as you're getting older, the possibility that the estrogen you're producing, which fits on that fibroid, will be reduced. So the fewer estrogen you have, the more the likelihood that your fibroid will begin to shrink. Very important. Okay, time is almost up. What's the menses of watery, or what is the menses of watery or filled with clots? Like I mentioned, when you have a watery light bleeding, it's normally experienced at the beginning of your bleeding. But towards the ending, you begin to notice some thick, some, dark brown, dark red color towards the ending. But if you notice that throughout your bleeding, it's not what it used to be. It's dark, it's brown. From beginning, 5 days, then there's a problem. We need to go and investigate. Okay. I'm going to take this question and then we're going to go for the day. If a woman has not bled since after myomectomy in December and induced her menses March, in which she bled for 4 days, normal, and spotted for 3 days, and has not bled since then. Now, what they did for you is what we call breakthrough bleeding. December, I want to believe, is December of 2020, right? Now, it's almost 12 months. This is November. So 11 months after your myomectomy, you haven't bled. You had breakthrough bleeding. You're still not bleeding. I'm worried. I want to know your age. I want to look at your hormones, because it's expected that after you've removed that fibroid, some women, when you remove your fibroid, apart from the fact that you will release all those burden you have in you, you will notice that your lovemaking will improve. You will notice you will no longer have pain when you're bleeding, because fibroid is a very big burden to so many women. There are so many women that are in constant pain from fibroid. So when you remove that fibroid, it's expected you have a relief. Now, in your situation, my sister, December 2020, and you just bled in March when they gave you some hormone drugs to initiate what we call breakthrough bleeding, and you're not bleeding currently, I want to know your age. I want to make sure you haven't gone into menopause. I also want to make sure you don't have hormone imbalance. I also want to look at your body weight. So if your BMI is high, if you have hormone imbalance, if you're stressed, if you have a couple of problems, including your thyroid, if you have hormone imbalance, the possibility you're not going to bleed is high. The only time is allowed not for you to bleed is when you're pregnant. So number one on your list when you're not bleeding, it's pregnancy. Once you're not pregnant and you are not bleeding and you are not pregnant and you haven't even gone into menopause, we need to know why. So I will advise you see a fertility specialist if you want to have a baby. And you've done the right thing by removing that fibroid. So any woman that wants to become pregnant and they told you have fibroid, please go and investigate that fibroid. If that fibroid is big, if that fibroid is giving you hell, and if that fibroid is inside your womb, go and remove it. Don't strive to become pregnant with a fibroid inside your womb, which is giving you hell, because that's the same place your baby will develop. So you don't gain anything carrying your fibroid over to your pregnancy, because there are so many ways it can cause you a lot of problems in your pregnancy. Okay, your BMI at 23 is pretty good. So if your BMI is 23, that's a healthy range. Now, the next thing I want to know is your age. How old are you? Have you seen a gynecologist? Have you gone for your hormonal test? Have you checked your AMH? Have you checked your FSH? Have you checked your LH? Have you checked your estrogen? Have you checked your progesterone? So this is what you need to do. I don't want you to go doing this by yourself. Call your doctor, go in. We need to investigate. We need to know why, because one complete year of not bleeding after removal of your fibroid is not normal. Okay, you're 36. So 36 means you're just on the cutoff point. Remember, when a woman gets to 35, her fertility begins to dwindle. Why? Because you have fewer eggs, fewer quality eggs. So every woman that gets to 35 is classified as what? Advanced in maternal age. If you want to be pregnant, if you want to become a mother, and when you get to 35, anytime you go to church, you'll be in the front seat. Why? Because your chances of becoming a mother is reducing every single day. So this is November. If you are attending this clinic right now and you're 40 and you're telling me, Doc, I'm coming, I'm not ready, let me pray about it. Guess what? By the time you enter 2022, it's possible you have lost all your chances. Some women will go into menopause since 2022. Some women will be perimenopausal. Some women will be postmenopausal. So know your chances. When you pray, also play. When you play, also practice. Don't just pray. Admin, if you can capture this for me and put it in our page, I will love that. When you pray, also play. When you play, also practice. Don't just pray without playing. And don't just play without practicing. Always pray, play, practice. If you can combine the three of them, nobody can stop you. If you are attending this clinic on the 6th of November, 2021, I have one word for you. If you want to be a mother, and if you step up your game, if you want to be a father, and you step up your game in the remaining days of November, you will become pregnant. How can you step up your game? By dealing with your reality, by telling yourself your truth, by looking at your chances. If you have a friend who is 25 and you're 45 and both of you are looking for a baby at the same time, you don't have the same chance. Your friend has extra 10 years to succeed in becoming pregnant. You at 45, you don't have any business discussing your plan with that 25-year-old lady because you're not in the same category. You can blink and you go into menopause. So if you are attending this gathering this afternoon, please take your bold step today. You see, I noticed a trend in this particular clinic. When I announced this topic out there, so many thousands, doc, tell me, I want to attend, I want to do this. But look at the numbers. Very, very poor attendance. But these are the people that want miracle overnight. But the biggest tool, the biggest weapon you use to defeat your infertility is knowledge. Some of you are worrying that you don't have a baby. Meanwhile, you don't have a problem, but you lack the knowledge. You're not going to the right place. So if you know any of your friends that indicated interest to attend this clinic and they're not in this clinic for this very important topic, share this video with them. Now, before you go today, please make sure you subscribe. So go to our page, hit on the subscription button, hit on the notification. The essence of subscribing and putting the notification is to know when I come live. I normally come live twice in a week. Tuesdays, 7 p.m. Eastern Time. Now, Saturdays, I come a little bit early by 6 p.m. or 5 p.m. Nigerian time. From tomorrow, it will be 6 p.m. Nigerian time. But because we're going to fall into, we're going to add additional 1 hour. From next week, my clinic will be 6 p.m. Nigerian time. So make sure you use everything we'll be teaching you to get results. Don't just show up and gulp all my info, then you're not doing your own part. My duty is to help you. Your duty is to allow me to help you. Now, if you need help, if you need to talk to me, if you need to consult with me, I can help you. Today might be the first day of beginning the journey of your motherhood. The testimonies you see in the group, they are real women that had real problems, but they overcame because they practiced the right way. So when you pray, don't just pray. Make sure you play. When you play, don't just play. Make sure you practice. When you practice, pray and play. The three components must be practiced together. God bless you. And okay. I don't know what Nana Fatima Ahmed is complaining about, but I hope I've answered everybody's question. My time is actually exceeded, but thank you for coming. I will see you guys again on Tuesday. Okay? Remember, if you're in our group, we have another clinic tomorrow, 5 p.m. Nigerian time, 12 p.m. Eastern time, US. I love you guys, and I'll see you guys tomorrow. Until I see you, God bless you, and bye-bye for now.